Hey guys, Dr. Nichols here, and I'm not really sure what to call this, except that I am not a specialist in disease. I am a specialist in people. And I think collaboration is very, very important because I will be the first one to tell you if I don't know. So one, either I will figure it out or I have very good referral other doctors that, my patients, are definitely in good hands with. But with that said, sometimes the ignorance with other providers can be a problem, and that can actually hinder, patients' success. And then patients kind of feel like they're in between a rock and a hard place. So I had a patient come in to see me as a new patient for infertility. She is a nurse, a 32-year-old nurse, and essentially infertility has been kind of unexplained. She has seen a multitude of different providers that specialize in infertility, and she has had a multitude of treatments. She was on Clomid, she was on HCG injections. They never did put her on progesterone. She's had a couple miscarriages. She did have one pregnancy that was viable. She was pregnant in October of 2018, but then she miscarried. And she's been trying to get pregnant since 2017. So a multitude of different things have been going on. And ultimately, since medications, she does not get a period on her own. She will have to take Provera, which is a progestin synthetic, every 2 months to get a period. She doesn't get a period. So one, we talked about testing and stuff like that. Not one time did anybody check her hormones. Novel idea. Check the hormones. So we did the appropriate testing. Again, saliva testing to check steroid hormones. I did do some blood testing on her, and she came in to see me to go through those results the end of September. And we did some stuff for her progesterone, did some stuff for insulin resistance. And to make a long story short, she sent me an email about her IVF consult at a large healthcare organization here in town. And she said that it went absolutely terrible. Now, one, infertility and, problems getting pregnant is very emotional as it is. And to, go to a provider or, you're going to look for help and there's no empathy and no guidance is truly horrible. So my patient sends me an email and she says, the doctor basically belittled and grilled me about my treatment with me and what testing I've done currently and in the past. She asked me why I was in her office and what I wanted her to do for me. And she grilled me on why I did my treatment. And she said so this doctor said that I don't know what I'm doing and that she can't treat her if she's following my plan. So I don't know who the doctor is. But to say that I don't know what I'm doing, one, I'm the first provider that has even checked her hormones. Secondly, I was asked to speak at an international infertility conference in June, okay? And three, even if somebody doesn't agree with what I do, that is not their role. Their role is to support that patient and collaborate, okay? I have developed the best relationships with traditionally trained doctors because of mutual patience, okay? Because there's that respect. There is that looking at things a different way. And, this patient's actually in healthcare. She's a nurse. And to be treated like that, and then for this provider to belittle my education, I was the first one to even look at her hormones. And so my patient said that, well, call Dr. Nickels, and I have no problem with that. And she's like, no, I'm not calling her. She won't change my mind anyways, and I won't change hers. Treatment is not about me, and it's not about the other practitioner. It is about what is best for the patient. And it just blows my mind, because now this patient is, like I said, between a rock and a hard place. Who does she listen to? Who does she go to? And it's very unfortunate, because a lot of times in traditional medicine, patients get scared that if they don't do this, they're not going to see the results. If they go another route, there might be other issues. And sometimes it's hard for people to make an educated decision when things are kind of muddled up, okay? So it's interesting that, again, this provider's not willing to work with me or talk to me, and they can just say that I don't know what I'm doing. I've been doing this for 18 years, and knock on wood, I've been very successful. But, at the end of the day, I have other infertility clinics that I collaborate with. So I wanted to send this patient to either Vios Fertility Institute. They're 2500 North Mayfair Road, Suite 420. These people are awesome. They definitely look at the whole picture, and all they do is infertility stuff. And they're so about collaboration, and the doctors there are amazing. Okay, so I gave her the opportunity to reach out to Vios. And then Dr. Laura Epperson, she's at Women's Healthcare. Her and I have been referring patients back and forth for probably 12 years. We actually finally just met a year ago. And so it was really awesome. But patients really, really love that collaborative care. And when there's mutual respect within the providers, patients do amazing. So if anybody's having problems, with infertility, conceiving, and you want to look at things from a natural approach, that's amazing. We can definitely do that. Once my patients get pregnant, I will send them to Dr. Epperson, because she's an OBGYN. I don't do anything like that here in the state of Wisconsin, and patients love her. If there's more things from an infertility standpoint, more investigation that we need to do, Dr. Epperson can definitely, look at that. But then also Vios, okay? They're amazing there. So if anybody has any, questions or, concerns, definitely reach out on Facebook. We can definitely give you more information in regards to Vios, Dr. Laura Epperson. But if you're having problems getting pregnant, you need to have providers that are going to be there for you and not put added stress. Because one, to be honest with you, that's a huge cause of why people can't get pregnant. So it's not about me, like I said. It's not about the other provider. It's about working together for the good of the patient. And I don't wish ill will on anybody, nor do I ever wish any patient to be in the middle of things, because it's one of those things where providers might have to agree to disagree and be respectful of that. So, infertility is definitely a hard thing to, take from just a provider standpoint, but then also a supportive standpoint for the patient. So if you know anybody that's having issues getting pregnant, there are options out there. And if you're not getting the information, the resources, or what you expect from your provider, you need to go somewhere else. And we definitely have resources for you. So anyways, I think I know what I'm doing. I think I'm very confident. And I know that these doctors here know what they're doing too. So you'd be in great hands if you saw any of us. So, okay, don't ever feel that you need to choose. And if you don't get the results or the information or the guidance that you need from your provider, you need to go somewhere else. All right, guys? All right. Take care.